Yes, I'm here today to present on our project, which is the long-term evaluation and modelling of the effectiveness and cost-effectiveness of whole school interventions for student mental health, which we call WISH for obvious reasons. It's a long title. So I'm presenting for the first half, and then I'll hand over to Jo Hewlin to present in the second half. There's been a huge number of people involved in this project on the screen, as well as beyond that. So the part that I'm presenting on is work package 1, which is the essentially quantitative analysis and looking at the effectiveness and cost effectiveness of kind of 2 whole school approaches to mental health. I'm going to do my best to cover both of them, but I think it may just be the first one. So the 2 that we've looked at was, so first we've looked at mental health support teams using Born in Bradford and Age of Wonder cohort data, and secondly we've worked with the mental health charity looking at their whole school approach, and they've kindly shared some data with us for that purpose. So Born in Bradford, Age of Wonder, you may well have heard of it. It's an excellent data resource. I really recommend looking into it. So Born in Bradford, a huge amount of children followed since birth. And the thing that we were interested, the variable we were interested in, is the strengths and difficulties questionnaire, which is measured in the kind of different time points and different subgroups, and it measures kind of behavioural problems that young people might be experiencing. And for those who are familiar, we use the Growing Up survey and primary school years survey within the Born in Bradford as our baseline, because we knew that that data had been collected before mental health support teams had been implemented in schools. And we followed up using the Age of Wonder, which is a 7-year project, also in Bradford. So it is a slightly separate cohort data set, but because it's in the same area, a lot of people are in both Born in Bradford and Age of Wonder. And crucially, they also measure the strengths and difficulties questionnaire in year 9. So that's about age 14, 15. So we used that as essentially a sort of follow-up point once we knew that for some schools there had been a mental health support team. For those who don't know, mental health support teams are school-based intervention, and they deliver interventions aimed at mild to moderate mental health issues in young people. They support the staff in the school, particularly by the senior mental health lead in the school, and they help support the school liaison with external services like CAMS and potential charities and other providers of services in the area. So I won't go into depth of the methods, but essentially, like I said, we use the Born in Bradford for kind of the before and the Age One for after mental health support teams to be implemented, and we compared those pupils that had gone to a school with a mental health support team and those that hadn't. So we were able to match that up. My colleague Holly Clark did a lot of kind of statistical methods to ensure that those groups were similar. And then finally, we're interested in using the LifeSim model, which was developed by our colleagues in York to estimate long-term cost effectiveness. I'm happy to answer more questions in detail, but I will go through it quickly here. So what I'm showing on the screen here is the average treatment effects of the mental health support teams in Bradford. And I've separated it into the sub-scores of the strengths and difficulties questionnaire, so peer problems, emotional problems, conduct problems, hyperactivity, and then internalising in the first 2 combined and externalising a conduct and hyperactivity combined, and the total difficulties of the 4 put together. So basically, this average treatment effect incorporates the kind of adjusting for age, gender, deprivation and ethnicity, and the interaction terms that we control for with the treatment effect. And what you can see here is generally everything's going in the right direction, but it was the intervention only had a statistically significant effect on conduct problems. So conduct problems is essentially like behavioural problems. And this for those that understand, it's about half a point on the SDQ score, but you know, this was everyone that had been in a school with a mental health support team versus not. So it wasn't kind of we looked at people that had 1-to-1 or anything like that. It was everyone as kind of, we didn't know exactly what they had, so it's kind of a broad effect. And then this on the screen is the average treatment effect in subgroups, specifically on that conduct score where we know there was an impact. And we looked at this because we're interested in how it might be effective in different groups. So what you can see here is generally there's a trend towards it being more effective for people with kind of low to moderate baseline problems, which does perhaps reflect the goal, which is for mild to moderate health issues and less focused on the more severe end of things. And there is a trend towards it being more effective for those that are less deprived, and then there's some differences that we've looked at for the data set. It's very much by ethnic, so white European, and then Asian or Asian British, specifically South Asian. And there's not a huge difference in terms of effect size, but it does seem that it's kind of statistically significantly effective for the white young people, and not so for the Asian or Asian British. But you know, it might just be that there's a little bit of noise there once we've narrowed down to the quite small groups, so it's worth understanding. And then not too much difference between male and female. And generally what's worth saying is everything is in the right direction. There is improvement. So this is the slide, which I realise there's a lot on this, but this is on the modelling. So the modelling we've done with the LifeSim model, which is developed by Richard Cookson, Yeva Skada in York, and essentially enables us to extrapolate from change in SDQ conduct into child and adolescent outcomes and into longer term adult outcomes. And the reason this is so important is that when we're looking at intervention for young people, there's obviously a really important change in the short term, but there's likely to be longer term changes that have huge benefits and also reduce a lot of public costs. So it's important to be able to estimate some of those and to capture as sort of the whole picture, the longer term benefit. So on the left hand side is some of the outcomes. To summarise, they're all good. So reduction in conduct disorder, reduction in poverty, and even a small reduction, these are estimated, was the estimated reduction in premature mortality. So while these estimated changes are quite small, this is an intervention that could potentially, you know, is being rolled out to all schools. So there's a quite, that those changes across everyone could have quite a substantial impact. And for those of you who are interested in health economic outcomes, so there's the incremental QALYs per person is 0.05. So QALYs are essentially just a way of measuring the benefit that represents the quality of life as well as the length of life. So while this is seems really small, it sounds quite small, because the intervention itself is relatively low cost, it still means that the intervention is, when you just look at health costs, cost effective. It's below the kind of, it's within the thresholds that are acceptable by NICE, but when you incorporate public cost saved, it's actually a cost saving intervention. So we estimate that the cost saved is greater than the cost of the intervention itself. So based on these estimates from the LifeSim model, you know, it's a really positive picture, essentially, that this intervention works well and supports young people based on our study in Bradford. So again, these are just the subgroups. I won't go into detail, but they reflect a little bit the same. These are the subgroups across the whole lifetime, but they do reflect the subgroups I've mentioned before. So I won't go into the detail with that. So conscious of time. So the other thing that we worked on was the mental health charity whole school approach. And this was in primary schools, so where there's mental health support teams that we were looking at for secondary schools, so they are in primary schools as well. We looked at secondary schools. This was in primary schools. And what I just want to highlight, without going through the whole results, is that we adapted the LifeSim model so that we could represent the full range of different problems that young people might have. So those emotional problems, peer problems, and hyperactivity as well. So kind of just expanding what we were able to do, and then we looked at the impact. But in the interest of time, I will pause there and hand over to Joe, who I hope is in the meeting somewhere.
I am in the meeting, so.
Nice. So there we go.
Brilliant, thanks Sarah. Good afternoon everyone. I'll just spend a few moments now going through work package 2 of this project, which involved a review of whole school approaches to mental health. Can you have the first slide please, Sarah? Great. So the aim of this project was to understand more about how or why whole school approaches to mental health may work, and under which circumstances. And as mentioned, we aim to do this through undertaking a realist review of the literature on whole school interventions. Next slide, please. So a realist review differs from a traditional literature review in the sense that it goes beyond focusing solely on whether an intervention works or not, and tries to understand how interventions work, who they work for, and in what contexts. So for our review, and in line with work package 1, we're looking at interventions which are delivered in both primary and secondary schools, and we considered both quantitative and qualitative evidence. And we included any evidence or any intervention which was described as being delivered as part of a whole school approach, which is often described as a strategy or an approach where all parts of a school work together to prioritise and embed mental health and wellbeing across the school environment. So, for example, this could include targeted one-to-one counselling for young people, but it could also include whole class assemblies, which are aimed at raising awareness of mental health and wellbeing. And it could also include interventions aimed at supporting staff and parents as well. Give the next slide, please. So this slide just shows you the various stages involved in the realist review process. So the initial stage involves undertaking scoping searches, where we develop some initial theories about how whole school approaches work. And these theories try to unpick the context in which intervention is delivered and also the mechanisms underlying the intervention, and then how these mechanisms and contexts interact to lead to various different outcomes, often described as CMOCs, or context mechanism outcome configurations. So we developed these, and then we presented these theories to our stakeholder groups and our PPI panel, which included teachers, young people and parents. And then following this feedback, we refined these theories further and shortlisted a sub-selection of these theories, and then ran some more targeted searches of the literature to try and find evidence which either supports some of these theories or refutes these. Next slide, please. So this is just an overview of the initial search process. So we identified 18 studies in this initial scoping search. And from these, we extracted over 300 potential CMOCs to start with. And then following stakeholder consultation, we got a shortlist of around 19. Next slide. So you probably can't make this out in any detail, but these 19 CMOCs were then used to develop this overarching framework, which we centered around 5 common mechanisms or processes which we believed underlied whole school approaches. So it's mainly for illustrative purposes. This we'll unpack some of these components in a bit more detail shortly. Okay, the next slide. Great. I think these slides might be slightly different. Could you go to the next slide, please, Sarah?
Okay, maybe give me a sec. Is it a different version?
It may be, but I can speak to these ones. I think I'll speak to these ones. So this is a snapshot of. So following that previous overarching framework, I'll speak to these, Sarah. That's fine. So yeah, the overarching framework. We then did some additional searching where we tried to identify evidence to support or refute some of those theories. So we screened around 2,000 papers there, and we identified 47 articles which were deemed suitable for inclusion. And this slide here gives you really just a kind of a brief overview of one of those findings, which was supporting the wider literature. So as you can see here, this identified trusting relationships as being a kind of key important mechanism which underlie whole school approach to mental health. It being suggested that students who developed these trusting relationships with staff were therefore more confident and more willing to reach out and discuss their mental health needs. And these relationships could be built if students felt they had more of a voice in school and were consulted on school matters. And this trust could also be eroded by other factors, such as if students were unsure about whether mental health disclosure were being shared more widely with other staff or external support or even parents, which was particularly problematic if some of the roots of these mental health issues did stem from the home environment.
Joe, sorry, just another minute or two to finish up, please.
Yeah, sure, I'll finish now then. Great, so we've got a bit. Yeah, so to conclude, mental health support teams are estimated to be effective and cost effective over a lifetime. Analysis of one-to-one counselling by a mental health charity also improved behaviours, emotions and relationships. And from work package 2, we identified sense of connectedness and building trusting relationships to be important in embedding whole school approaches. And thanks everyone for listening. Cheers.